Hi, I'm Dr. Eric Mazer. Today's Ask the Expert question is, how can stroke be prevented? On the set today we have Michele Lecardo. She's the stroke prevention or stroke program coordinator at Norwalk Hospital. Very important topic, Michele. How can we prevent strokes?
So the best way to prevent a stroke is to be able to identify your own personal risk factors. There are risk factors we cannot change, which is race, age, ethnicity. But there's also risk factors that we can change, and that would be things like your high blood pressure, diabetes, hypertension, high cholesterol, any type of arterial disease, smoking, lack of exercise, obesity.
So managing each one of those reduces your risk of stroke.
Yep, and some of them might not be your personal risk factors. Recognizing which ones are your personal risk factors, which ones you fit the category for, managing that will reduce your risk for stroke.
So smoking, everybody can do.
Absolutely.
And but think something like diabetes. I think people don't realize that so much of the negative outcomes of diabetes are due to vascular disease, heart attacks and strokes. I think people think of kidney disease, and yes, that is one way you can get into trouble, but simple things like heart attacks and strokes are very commonly threaten the lives of people with diabetes.
Yeah. So managing your hemoglobin A1C, really paying attention to that number and really paying attention to what your blood sugars are running and working with your endocrinologist to keep them at the acceptable range to decrease your risk of stroke. If it's managed, you decreased your risk.
So there's so much we can do to prevent stroke, and we shouldn't just think, well, that's an act of God, I'd be susceptible to it. Unfortunately, we are out of time for now. I want to thank my guest, Michele Lecardo, for joining us on Health Talk today. She really has educated us on stroke prevention. If you have comments or questions for us, please email us at newvancehealthtalk@newvancehealth.org. Thank you for watching.